morning, viewers. Today we're going to be talking about train tracks and how they influence the entire body. I've got a patient here that's had several falls, and she's actually broken a hip and had to get a hip replacement done as a result of the falls and breaking the hip. And with that, she had a SI joint problem because the SI joint was knocked out of position, which gave her a lot of back pain, and she struggled to walk. Then she had a fall again this week, and she fell on her knees and she hurt her right hip, which has made the entire leg stiff, and her right shoulder is also stiff and sore. So she's got needles in everywhere. But what I wanted to talk to you about today is about the different train tracks in the body and how it influences the body in creating chronic pain. So our posterior train track, you've got 6 train tracks. And the first train track is your posterior train track, which starts at the back of the head and it runs down the spine on either side. It then links over to the hips, down the hamstrings, down the calves, and ends on the sole of the foot. Your anterior train track starts on the front of the toes, runs up the shins, runs up the thigh, crosses over to the middle of the stomach, runs up the stomach, comes round and ends on the back of the head here with your implantation of your sternocleidomastoid. You've then got your lateral train tracks and your spiral train tracks, 2 on each side, which makes up your 6 train tracks. And what happens is when you have an injury in one area, so say for instance we have an injury in the lower back, which is quite a common occurrence, or we have an injury in the neck, the one will then activate the other. So I've noticed within a short period of time of having a neck pain or a lower back pain, within about 2 months you will find spasms on the opposite side, and it's because of your train tracks. So the muscles are all in the same line. So your neck pain will activate your thoracic pain, which will activate your lumbar pain, which will then activate pain down the legs, which will activate calf pain, which will activate foot pain. Now you can have all the pains in all the train tracks, or you can have some of the pain in some of the train tracks, but it's usually because of that. And once you've activated the one train track, if there's a muscle in the one train track that is linked with a muscle in a different train track, you will activate that train track as well, which will then cause chronic pain, and it's like a wildfire that spreads. So what I've done here is I've now got the needles that we've put it in the side of her neck for the lateral train track, and we've got them here in her arms as well, also part of the train tracks here. And then I've got them down in the middle train tracks here in the lower back, running down the glutes here, into her back of her leg here, and we haven't done the calf yet, but we have done it before to help with the train tracks. So once I've taken out the needles, I will then go in and massage the area, and we'll use the hypervolt to loosen it as well, because it's got a nice vibration speed to it. But we need to work the entire area just to fix the area that she's complaining about, which is her hip and her shoulder. Okay, she's got lots that she's complaining about, but we need to work in train tracks to alleviate the problems so that we can get them better. So that's the train track video. Like and subscribe, send to your family and friends if they've got chronic pain and pain in global areas. And remember, you can have a look at the stretching DVD to help with your improving of your range of movement generally of the body, and to help to release the train tracks so that they become more pliable and flexible and reduce pains. But massage is key, needling is key, vibration is important, and heat is important with the stretches and the exercises. Have a wonderful day. Like and subscribe. Bye.